The OCTA Research Group is calling for a circuit breaker lockdown in parts of Metro Manila because of the threat of the Delta COVID variant. We have Professor Guido David joining us via Zoom to discuss this further. Good afternoon, Professor Guido. Can you explain what a circuit-breaking lockdown means in the Philippine context, and which areas will likely be affected by this?
Yes, hi, good afternoon, Sean. So the circuit-breaking lockdown is, well, the name is derived from, it's used in other countries like Singapore. So it's used like a stopgap measure. But what we are doing here is a little more preemptive than what had been done in the past. What we're saying is that while the cases are still at a sort of manageable level in the NCR, they will not be for long. So if we wait too long to pull the trigger, we might be in a similar situation like we were last February, March to April, when we had up to 5,000 cases per day in the NCR. So what we're saying is, while we can still manage this, if the cases are rising, and we should be looking at a more proactive measure such as a circuit breaker to reduce the cases almost immediately. So in that way, we don't have to endure a 1 or 2 month long lockdown. We could just have a 2-week period of a lockdown to control the spread of the Delta variant.
Right. Well, how difficult would that be to carry out here when you're talking about just locking down specific areas? We know that people slip through borders and checkpoints quite often. Is there any recommendation beyond, having to do this on how to enforce this effectively?
Right. Well, yeah, I agree, Sean. It may be a challenge to implement this locally. So, we could probably do it like a per district, or even the whole of the NCR. Of course, right now, what we're seeing is that the whole of the NCR, while it is increasing, the surge is not happening yet in all the LGUs in the NCR. And this is similar to what we saw last February to March when it started in Pasay. Now, last time we had the surge, they had barangay lockdowns in Pasay, but it was not able to control the surge. As you mentioned, people would be able to slip through borders and stuff like that. So we might have to be, look at more stringent measures, or possibly, having an MECQ, for example, for the whole of the NCR, some sort of MECQ flexi, for example.
Right. You also mentioned that, one day we could be okay in managing it like we are now, and then the next day, before we know it, things are already out of hand. Having said that, is there a calculation? How do you guys figure out, that sweet spot where we're supposed to, act tougher or have more stricter measures in place? Do you guys have an algorithm or an equation for that?
Yeah, we actually do, Sean. What we're looking at is the surge capacity, which is the number of cases that the NCR is able to handle before it becomes overwhelmed. And that sweet spot is somewhere around 2,000 cases per day. Now, right now, we're averaging 970, close to 1,000. So that means we're not that far away from, what you call the sweet spot. So it may seem like it's far away, from 1,000 to 2,000 cases. But let's remember, just 2 weeks ago, we just had 600 cases. And if it's increasing exponentially, we could be at 2,000 cases in about 2 weeks. So that's why what we're looking at is that if we have the circuit breaker sometime, for example, in the later part of this week, for example, from August 1st, then we could stop the rise in cases at around 1,500 cases, for example, before it gets to 2,000, and then we can reduce it quickly to maybe down to 600 cases in about 2 weeks. So that's what we're looking at, and we hope the others will be on board with this strategy.
Right, definitely. We're looking at geometric progression as opposed to an arithmetic progression, if this is mathematics. Now, more numbers here. We have the DOH reporting some 7,100 new COVID-19 cases today. What is your reaction to this number? Have you seen the breakdown?
Well, we haven't seen the breakdown, Sean, and this is unfortunately a high number that we did not expect on a Tuesday. Usually Tuesday's numbers are slightly depressed compared to Monday's numbers. Usually there is a decrease from Monday to Tuesday if we go by history, and that's because of the weekend factor. So if we're getting 7,000 cases per day, I know that last week I made a sort of a premature projection of 8,000 cases, but that means we're actually on track to get to around 8,000 if we don't put a stop to this soon. And right now, we're seeing an increase in NCR, but the situation in Cebu City, Mandaue, and Lapu-Lapu is actually worse than in NCR because the reproduction number is already at 1.9, whereas in NCR it's still at 1.33. So right now we can still maybe put a stop to this surge in the NCR, but in Cebu City and also in Cagayan de Oro, they have a massive surge there, a resurgence, and we also know about Ilocos Norte and Ilocos Sur having a surge.
Right, so apart from lockdowns, which the palace is also not keen on imposing just yet, they're saying there's no need for it. You also said there's no need for it, but then we also have to look at, all of a sudden, we have an outbreak staring us or another surge staring us in the face. So apart from lockdowns or circuit breaking lockdowns, what else can we do?
Well, just to clarify, Sean, I think what we mentioned last week, we probably didn't need to go to a strict lockdown because we wanted to try GCQ with heightened restrictions, for example. But right now, what we're seeing is that it's not having its full effect on the NCR because cases are still rising. And if, like you mentioned, we have 7,000 cases today. That's actually a cause for alarm, and I have to see the breakdown. It will probably come out tonight. But apart from that, we could also increase our border controls, which we should be doing. We could implement a bubble around NCR, maybe NCR or NCR plus, to contain the pandemic, and also to protect our borders. And curfew hours, we could probably even scale it. Increase curfew hours again. Maybe we could reduce it to 8 p.m. or something. Reduce, social gatherings at this time, and we could probably limit indoor dining and capacities inside offices at this time, because if the Delta variant is spreading, we know how contagious it is, especially indoors. Now, we might be able to have some be creative with the way we're handling this lockdown as compared to previous lockdowns, because we have I heard we have about 20 to 30% fully vaccinated in the NCR, maybe close to 30%. If that's the case, then vaccinated people may be at liberty to, for example, dine inside, dine indoors in indoor dining, and capacities in offices can probably accommodate vaccinated individuals because they're not at risk for severe cases. So we can maybe think of creative ways to have a lockdown while balancing the economy, and that might not sound popular to some, or might not sound good to some people, but it might be our best strategy to balance the two.
All right, and I think one last question. How is hospital capacity? When I'm talking capacity, I'm not just talking about bed space. We need like ventilators and all these other apparatus that India didn't have when they were facing Delta, and I think that makes all the difference. In your observation and from what you know, do you see an increase in capacity all throughout hospitals?
We might have increased some capacity, but we know that many cities in the provinces are lacking in ventilators and ICUs, and that's why it will be a definite struggle for places like maybe Cagayan de Oro or even for example General Santos or Lawag. Lawag I think has only 2 ICU beds, but they're not occupied yet at this time. I mean, based on the data. So I'm not. It's not clear to me how much we have scaled up hospital capacity or our healthcare utilization. I believe that DOH can scale them up on demand. What I mean is once this, if and when the surge hits, that they'll be able to add these capacities. So I'm quite confident about that. But of course, every capacity has its breaking point, and that's why we talk about the surge capacity. So we hope it will be able to handle the surge. I mean, and that's why prevention is actually the best strategy. So right now, in terms of occupancy, our hospitals are still okay, and the NCR ICUs are still okay at low levels, but they won't be for long if we have a surge.
Those points still, of course, self-discipline is the best way to move forward with this. As always, thank you for your time and your insights, OCTA Fellow, Professor Guido David.
Thank you, Sean.